And we left off, we were just describing resistance. That was the last thing I think we left off at. And we kind of talked about that relationship between the various factors that affect resistance and then how those various factors in turn affect flow. So that was where we left off. And so at this point, we're going to look at a few checkpoint questions that kind of cover everything we've talked about so far. So we'll just kind of discuss these openly. Feel free to share responses either verbally or in the chat. And the first question, what is a pressure gradient and where are pressure gradients present in our vasculature? So first off, what is a pressure gradient? And then what are the pressure gradients that we see throughout our vasculature? Any takers? Any guesses? So how would you describe a pressure gradient? I know it's Monday. No, go ahead. Sorry.
It's the way that the blood will flow. It's like the driving force, so it will move from like a higher pressure to, or move from the higher pressure to the lower pressure.
Right. So it's excellent. It's the driving force. I'm also seeing that in the comments. It's a driving force. So blood is moving from high pressures to low pressures. And so the gradient is really just that differential, right? What is the highest pressure minus that lower pressure? And that we describe as being the driving force of vascularizing our system. So what are the what are the pressure gradients? Kind of gave it away there. What are the pressure gradients that we see in our vasculature? So does anyone remember the pressure gradients that we see in our vasculature? So someone's saying radius. Radius would be our response to the second part of the question. But here we're talking, excellent. So I'm seeing systemic and pulmonary. So that's absolutely correct. So the systemic pressure gradient we said was much larger. There's a larger pressure differential. There's a larger driving force in the systemic circulation. And then we've also got a pulmonary pressure gradient, which is a smaller drop off, right? Because it's a shorter ways to go and there's less pressure in the pulmonary circulation as well. So those are the two pressure gradients that we see throughout our vasculature, the systemic and the pulmonary, one much greater than the other. And then for the second question here, what are some factors that affect resistance in the vasculature? And then how does resistance affect blood flow? And I'm seeing a correct answer here in the comments. So radius is one factor that affects resistance. Excellent. Length of the vessel, viscosity of the fluid are the other two factors. So the three factors we said that influence resistance: the viscosity, how thick is that fluid, that blood, for our purposes; the length of the vessel, how long is that vessel, or conduit if you want to think about the physical laws here; and then the radius, how wide the lumen is for flow. Excellent. And then how does resistance affect flow? We kind of talked about this relationship, whether it's directly proportional, indirectly proportional, or inversely proportional. So what is the relationship between resistance and overall flow? Excellent. More resistance, slower flow. That's absolutely correct. So if we have more resistance, that means we have more impedance, more blockage to flow. And so we're going to have a slower rate. Remember, flow is a rate. And then if we have less resistance, we're going to have a faster rate or a higher bulk flow. Okay, excellent. So that's kind of where we left off. We were talking about resistance. Another question here, is flow Q or is resistance Q? So flow is Q. Resistance is just represented by a large R. Okay, so flow is going to be Q. Okay, so let's keep going here with resistance and talk about how we can regulate resistance. Now, most of our arterioles have this ability to influence or manipulate or regulate flow by regulating the radius, specifically with arterioles, and then to some extent, small arteries as well. And it does this via two mechanisms. The first one is called vasoconstriction. And vasoconstriction is where we decrease the radius, which increases the resistance. And then the second mechanism is vasodilation. We simply increase the radius, which is going to decrease the resistance. And just to talk about how this is brought about, if we look at the structure of our arteries and arterioles, there's a thick lining of smooth muscle there. We'll talk about the structure coming up in a few slides, in the next packet. But when we relax that smooth muscle that's lining those arterioles, we make more room for flow. So that is what vasodilation is, relaxation of the smooth muscle that's lining the arterioles. And on the alternative end, if we constrict that smooth muscle, we make it kind of, tense. We decrease the room for flow. That's called vasoconstriction. And that's where we're going to start to introduce resistance. So the wider the lumen, the more relaxed that smooth muscle is, the more vasodilation we see, the less resistance. Whereas the narrower the lumen, the more constricted that smooth muscle, the less space for flow, and then the more resistance. Okay, and then at the bottom here, we already talked about this phenomenon, the fact that the pulmonary circuit has less resistance because it's got a lower pressure gradient, and it also has smaller, it's also shorter. The length that we have to travel in the pulmonary arteries is shorter. The length of those vessels are shorter. We see less resistance throughout the pulmonary circuit. Let's talk about combined resistance. So when we look at the resistance found throughout all of the vessels in our systemic circulation, that is described as total peripheral resistance, or TPR, is what we'll refer to it from here on out. So TPR takes into account all of the resistance that's encountered in all branches of the systemic circulation. And we'll talk about those individual branches where TPR may be where the resistance, not TPR, the resistance may be slightly more or less, like in the arterioles, we have a lot more resistance, but we're not looking at any one specific branch when we look at TPR, we're looking at the combined total resistance throughout the systemic circulation. And so we can think about vasoconstriction happening in our entire network. That's going to bring about an increased resistance and decreased flow throughout the entire systemic circulation. And alternatively, we can think about vasodilation happening throughout the entire network, which is going to decrease resistance throughout the network and make it easier for blood to flow and vascularize our systemic circulation. Okay, so whereas we've been speaking about the resistance of one vessel being influenced by the radius of that one vessel, we can think about it more holistically, that the TPR is going to be influenced by the radius of all of the vessels that are seen throughout the systemic circulation. So if we increase the entire network of radius, if we increase the radius of the entire network, we're going to decrease the resistance of the entire network. And if we decrease the radius of the entire network, we're going to increase the resistance throughout that network. Now, the last bit here is kind of putting it all together and then relating it to our physiology. So when we think about flow, we've described this equation for flow as being our pressure gradient or pressure differential divided by the resistance encountered. And we can kind of plug in some of our own physiologic values for these physical parameters. So for flow, we can plug in our cardiac output, right? Does anyone remember the equation that we talked about for cardiac output? So you need to remember that equation for cardiac output. Just to kind of relate cardiac output to flow. So we talked about cardiac output as being excellent. Yes, stroke volume times heart rate. So remember, this is a rate, right? We said it was about 5 liters per minute. And I really want to underscore that because that relates to flow as well. We said flow is also a rate. And so we can plug in cardiac output in the place of our flow. We can also think about our pressure gradient as being mean arterial pressure. And I kind of want to explain this here a little bit. Students are often confused by this, this part here. Now, we describe the pressure gradient as being a pressure differential. So the mean arterial pressure minus the central venous pressure. And so most physiologists kind of just ignore the central venous pressure altogether because it's such a small number. It's about 2 millimeters of mercury, and it's really kind of negligible. And so physiologists just simply plug in the larger number, which is the mean arterial pressure, in place of the pressure gradient. So I kind of want to explain why we plug in mean arterial pressure instead of mean arterial pressure minus central venous pressure for this value. So we can simply kind of ignore central venous pressure, because if we took 85 millimeters of mercury and we subtracted 2 millimeters of mercury, it's 83, which is really very close to 85. And so for our pressure gradient, we can simply replace that with our mean arterial pressure. As far as R, which is our resistance, that's going to be equatable to our total peripheral resistance. So again, we're not thinking about the resistance of a single vessel, but we're thinking about the combined resistance that's encountered throughout the entire systemic circulation. And so when we plug each of these physiologic values in for this equation, we can replace our initial equation with cardiac output equal to mean arterial pressure divided by total peripheral resistance, okay? So this is a truer reflection of our physiology, of this equation, of this relationship as it applies to our physiology. And so a very simplistic way to express this is that flow throughout our system is equal to the driving force, which is really our mean arterial pressure, divided by any resistance, any impedance that's encountered throughout that circulation. Okay, really important relationship to highlight and underscore. And this is going to be the more important relationship that we talk about when we move on to really look at our physiology. But we really want to understand how this initial physical equation relates to our physiology. Okay. So that's it. Let's actually look at a few practice questions and then we'll move on. So I'm going to launch a poll. And I apologize, there's no option for E. Okay, last few seconds. All right. So the question, which of the following would increase the rate of blood flow through a blood vessel? And then many persons selected C, which is correct. So increased pressure entering the vessel is going to increase the blood flow. And we can replace this word blood flow for bulk flow or cardiac output, right, in our equation that we talked about before. So also be thinking about the practical ways that we can ask or we can phrase the relationship that we talked about. So simply flow, we can think about it as being perfusion, we can think about it as being cardiac output. It's all referring to the same thing, the movement of blood through our system, and which of the following factors would influence that, would increase that. And so the only appropriate answer here would be to increase the pressure, which would be synonymous with increasing mean arterial pressure, which would increase overall flow. Let's look at some of the other options that were here. Increased viscosity, we know that's going to increase resistance, which will decrease flow. Constriction of the blood vessel, which would be synonymous to decrease in the radius, right? These are the same two ideas. If I constrict the blood vessel, I'm going to make the radius smaller. Those two would, excuse me, increase resistance and decrease flow. And then D, increasing the length of the vessel will also increase resistance and decrease flow. Okay, just to make sure we understand why some of those other options are wrong. Let's look at another question here. All right, final few seconds. Okay. And so the question, which of the following would decrease the rate of blood flow through a vessel? And so this is going to be the opposite of the question we just talked about. Many persons selected A, and that is correct. If we increase the viscosity of blood, we are going to increase the resistance, and that is going to decrease the flow. All of the other options would decrease resistance. If I vasodilate the blood vessel, which is synonymous with increasing the radius of the vessel, so once again, B and E are the same idea, I'm going to make it easier for blood to flow by decreasing that impedance or decreasing that resistance. And then option C, if I increase the pressure, that will not obviously not decrease flow, that's going to increase flow. And then option D, if I decrease the length of the vessel, I am going to be introducing more resistance, which again will, if I decrease the length of the vessel, I am going to decrease the resistance, excuse me, and that is going to increase the flow.